This session is part of a webinar series which aims to assist researchers, librarians, and institutions in the adoption of digital tools and persistent identifiers for a significant increase of research discoverability globally and to increase efficiency in scholarly workflows.
My name is Keleto Masisi, and I'm the project coordinator here at Africa Archive. And for those who don't know, Africa Archive is a community-led digital archive for African research communication, and we enhance the visibility of African research and enable discoverability and collaboration opportunities for African scientists and the world or globally. On our webinar series today, we have our speakers, Roseline Dzekem Dine, founder of Rwanda Preprint Club. We have Patience Sindayigaya, member of Rwanda Preprint Club as well. Nuhu Lawan, Mercury Shtindo, who is the co-founder of Bioethics, and Dr. Azuka Okafor, member of eLife Global South Committee. And on our topic today, we'll be speaking on advocating for preprint sharing in Rwanda. And before we go on into our webinar series, I'll just like to briefly tell you a little bit about our speakers today. I'll start off with Roseline Dine, who is the founder of Rwanda Preprint Club. Ms. Dine is a public health professional and a social scientist in her early career. She has a background in sociology and anthropology from the University of Buea-Cameroon and a master's in public health from the University of Rwanda. Our other speaker is Mr. Patience Sindayigaya. Mr. Sindayigaya is a member of the Rwanda Preprint Club as well, with three years experience in community engagement and outreach activities with a background in nursing. He has successfully implemented initiatives to enhance health awareness and improve access to healthcare services. Our other speaker is Dr. Azuka Okafor. Dr. Okafor is an African Union scholar in reproductive health, a clinical embryologist, and a lecturer at Ndani Eziko University, where he teaches medical and allied science to students. He also conducts reproductive health research and drives reproductive health advocacies through the university. Our other speaker is Nuhu Lawan. Mr. Lawan is a nurse and scholar who holds professional registration to practice as a registered nurse educator, and a registered peri-operative nurse. He has a bachelor's and master's degree in nursing science, a master's degree in health planning and management, and is currently pursuing a PhD in community health nursing. Our other speaker is Mercury Shtindo, who's the co-founder of Bioethics. Ms. Shtindo is a bioethicist and researcher, currently serving as the chair and executive director of the Africa Bioethics Network, where she leads initiatives advancing bioethical discourse across Africa. She's also the co-founder and co-editor-in-chief of the African Journal of Bioethics, contributing significantly to scholarly publishing in the field. So those are our speakers today. We try to make it brief so you could get information on them. And for now, I'll pass the floor to them to hear on that presentation. Thank you.
Thank you, Caluso, for the brief introduction. And I'm going to share my slides so we can start. Hello, everyone. Good morning, good afternoon, depending on where you're joining us from today. So we are going to be presenting on advocating for preprint sharing in Rwanda and Africa. So myself, I am Roseline Dzekem, as Kisulo has already introduced myself. And today's topic, we're going to be covering a brief background on preprints and the benefits of preprints, how they support scientific progress, challenges and opportunities, sharing of experience from members of the Rwanda Preprint Club. And as a brief introduction today, I will be saying that preprint is not something that started today. It is something that started over the 1990s with our archive, with the founder of Paul. And it started with simple sharing of emails by Joanne Cook, who started it with text file of string stories in the physicians who were in his mailing list, and that has already accumulated to one of the strongest repository for preprints. If I checked few days ago, and I found that we have over 2,500,000 preprints already posted. And on my right here, you can see the growth, how preprints have grown from 1991 up to today. And preprints are being posted in different domains: economics, social science, biology, and what have you. But we have realized that biology is the most posted submission in this repository, with submissions as around 1.2% in 2021. And during the COVID-19 days, we found that it gave preprints a very strong standing, where you could see that the number of preprints posted in the COVID-19 days kind of, can we say, skip, and the margin from the days that previously, before the COVID-19 days, the number of preprints that were posted drastically increased. And you can see with the blue light here and the pink plots. So it indicates an increase in the number of preprints posted, and in the different charts, you can see the percentage of the preprints that were posted before and the time period. Okay. So today we have over 50 preprint savers globally, and we are also happy and privileged to be hosted as part of one of these repositories in Africa, which is AfriArchive, and we have Africa Archive right here. We also have other preprint savers all over the world, and you can find them listed here. So why do we prefer preprints? Is because it's a little bit, it's faster than our traditional journal. So we're going to walk through the path where in a traditional journal, you have to initially, first of all, submit your article or your manuscript. And upon submission, you don't get initial feedback until after some days, weeks, or months. And sometimes it comes back with a surprising message saying that your article has been rejected without it actually moving to the next stage or even having public attention. And even when it eventually does, it must have taken some months, and it has to go through the peer review process where reviewers are being invited over a period of around 3 to 6 months for you to get their attention and feedback regarding your work, and it has to be revised. And if it's revised, and after revision, they might reject it and send you back to start from scratch, or they might give you another round of revision. And then it takes about years, months for your article to be actually finalized in the review process, and also being given public attention for people to enjoy or benefit from the science that you are seeking to pass out there. However, with the preprint, immediately as you start working, start communicating your science, the global community is already enjoying what you are projecting, what you're trying to communicate in less than 48 hours. And you can already have public interaction, feedback sharing, and community contribution towards the idea that you are presenting to the global community. And so that brings us to the benefits of preprints. With preprints, you can have or receive a persistent identifier that you can cite just like a normal journal will give you the idea. So those are some of the benefits of the preprint. And with preprints, you don't need to have a publication cost. There is no subscription fee. You can access preprints from wherever you are and whatever institution you're being hosted by. So there is no need for any payments of anything whatsoever as compared to our traditional means of communicating science. Another interesting thing about preprints is that you have the opportunity to receive feedback and collaborate with people around the world as you share your even at the initial stage of developing your work, you're already getting support, and that gives you the chance to be able to improve and share science that it's acceptable and much valuable. It also allows visioning and easy updates because it has persistent identifier. You can then adapt and update the different versions of your preprints according to the days dates and the version, and it will also have the persistent identifier that can be used, and that is what open science and access should be all about. So it doesn't mean that after preprinting your article, you will still not be able to publish in different journals of your choice. It's still compatible with journals, and this is what preprint journals and repositories such as eLive are also promoting. The eLive will only review articles that have been pre-printed, and you are still very, very free to publish with a traditional journal upon preprinting your article and getting series of revisions and making your science stand. So even today, traditional journals are also advocating that articles should be preprinted to benefit, to have some of these benefits. And we shouldn't be afraid of our work being scoped because our preprints have already persistent identifier and they are being protected by the dates of records. Thank you, and over to Mercury.
Thank you, Roseline, for giving us a good start to preprints, what it does, how it works, and what is the process, what goes into it for you to actually say you have a preprint. Will take us through this brief session. How do they support scientific progress? And when we look at it, we can look at it from many different angles. The first one would be promotion of science. You can skip to the next slide. The first one could be, okay, let me, I can share my screen. Okay, thank you. The first one would be, first and foremost, we are making our researchers ourselves more more visible in terms of the work that we are doing. We're making science by itself more inclusive. But then when you look at the model of preprints, it directly helps scientists or researchers to be able to improve the methodology and analysis. This is now before you publish. You normally have a choice of letting it remain as a preprint or now going ahead to actually publish it wherever you want to publish. And before this happens, your work would have been publicly, it would have been in the public coffers. It would have international experts looking at it. So you're looking at it from the angle of enhancing research, enhancing scientific progress, because you will receive feedback that will help you be able to improve this particular work before finally publishing it. And we've seen this really helping in terms of improving studies and the work that is eventually put out here. And you can see when you talk about also, like when we have, right now we have Mpox, we had COVID. When you talk about a situation where you have an active problem or health emergency, we are able to see how this quick review and being able to publish in terms of preprints or just making available the work that people are doing is going to help in terms of advancing any situation we have on the ground. Next slide. Apart from this, we have seen that when you have a preprint, you are still able to cite your work. Your work will be in the public coffers. It will be in a place where people can access what you have done. So this can actually help you be able to improve your career. It can help you develop your career. You might be asked to go and speak to regional conferences. It could be national, international, but because of the work that you have done, people can be able to now engage you. They would say, Mercury did this. We would want to learn more about Mercury. And sometimes people would want, the people who are also doing the same thing, they might reach out to you and say, can we collaborate? Can we, because they have seen what you are doing. Because you're looking at it from the angle of, if I was doing it traditionally, I would take like almost maybe 2 years. I would say there's a paper up. This is from my own personal experience. This is the 4th year, it's a book. This is the 4th year. We've been told it will be published. I think it might be published next year, which will make it 5 years working on it, which is not bad because you want the work to be very good. The problem is sometimes, like they did come back to me like 3 months ago and tell me I have to refine my paper so that it fits the current times, because when I wrote it, it was during the emergency COVID. So right now, it's not really an emergency, so I have to change the tonation. But you can see some of the disadvantages we have. Please go to the next slide. So I just pulled this online from a researcher who is also from Rwanda, who just said that they chose to put their work as a preprint because they're able to share their findings earlier, make it accessible, and yet they did still eventually publish the same work, as you can see here at PLOS1. Next slide. So when we are looking at some of the things, I believe this is one of the challenges which our next speaker will be speaking about. When we had situations where people would only publish what is good, and whatever there are normally lessons learned whenever research is done, whether it's negative or positive. So we are now able to see all of this being published. We are also being able to avoid places where people would be able to reject your paper based on many other biases. Next slide. So next slide, please. So when we look at okay, you've jumped, but I'll just speak about it. When you look at research from now your context, we look at it as a way of equalizing scientific communication. We are able to bypass some of these barriers and be able to increase the visibility of research globally. And this helps be able to just showcase, the Rwanda's potential for research and capabilities across the world. So when you are finally reaching that place where you want to actually use or do a preprint, you need to be able to know which server you want to use. We have different ones, as Roseline pointed out, and you look at what will be able to help you, with the work that you are doing. We have discipline-specific servers which have targeted audiences. Do you want to go for that? We've seen we have for biology, we would have for social sciences, but we'd also have others like Africa Archive, where you would be able to just put from different disciplines. So when you are writing your preprints, you want to be able to state, sorry, that's my timer. You want to be able to state clearly what is your local context and what are the implications, and ensure that Rwanda features very prominently in whatever work you're doing, so that you can be able to increase visibility not only to you, but also to Rwanda in general, which will be able to also help you contribute to some of the national research priorities you have in country. Thank you. We move to the next speaker, who will be able to talk about some of the challenges. This was a way forward. I'm out of time, but we have spoken about this already. So our next speaker is Dr. Okafor. Please take us through the challenges and opportunities.
Thank you, Mekuri, for that wonderful presentation. So I'm Mr. Okafor. I do research at Nnamdi Azikiwe University, and I'll be driving further the conversation, and I'm going to be looking at the challenges and the opportunities of sharing preprint. I'm sure you're wondering that 3 decades into the use of preprint, at least we are still talking about awareness, for example. So you can agree with me that the adoption of preprint in Rwanda and in fact the rest of Africa is rather slow. So 3 decades into it, we still have limited awareness, adoption across universities and across different research institutes. So this is one of the major challenges, because when you meet people and you want to ask them, do you know what preprint is? So either they don't know or they don't have the real details of what the benefits of preprints are. Then you have concerns again about intellectual property. People are thinking that when I put my work out there and it's not yet reviewed, people are going to just come and of course scoop the data, just like Roseline had said, but there is a date stamp on each of the preprints that have been published. Of course, I agree that I have personally also witnessed cases like that, where you have, someone take out data, go elsewhere, and do a faster publication in a traditional journal model. And those cases, we have pockets of them. But the important thing is that these issues are still not as tenable as people perceive them. Then you also have a false perception on the credibility. Yes, I agree that there is need for peer review. For a preprint is not yet reviewed as at the time it is being published. So people, cast aspersions on the credibility of that particular study. But the truth is that, just like Mekuri has said, it further strengthens the credibility of your work, because at the right, the time you actually share that preprint, from day one, you are getting feedbacks, you're having interactions, you're having discussions, people are reaching out to you, and you are improving the quality, and that also speaks to the credibility of that work. Then we talk about the issue of sustainable funding, with respect to maintaining and floating preprint database. That is really an issue, especially in Rwanda in institutions, because it is expected. I, for one, am an advocate that any journal should have a preprint platform, such that while you are still trying to make that review, that work is being, getting the recognition that it deserves. But then again, are we able, in Rwanda and even in Africa, to fund that model? even the preprint platforms that we're having at the moment, what exactly, there is a decision as to the model of finance and the model of, economical model that each preprint database will adopt to be able to ensure system. So this is still a challenge in Africa. Then we have issue of support, by traditional publishing system. We still have, as much, journals begin to adopt the idea of reviewing preprints, we still have a couple of them, who do not actually want you to submit your work as a preprint before you reach out to them. So this still poses a challenge, to advocating for preprint and even sharing preprints by some of our scholars. So publishing systems, academic institutions, the issue is when I publish my preprint, will some institutions, appraise me as, for example, as a researcher, within that system, or even as, appraise me as an organization, if that study has not yet been reviewed. So I believe that when we start making advocates towards, assessing and appraising preprint, and giving it the recognition that it deserves, more persons, will welcome that idea. Then we have issue of priority for high impact. The truth is that in the academic language, we say publish or perish. And not just publish or perish, people are paying attention to metrics. There is still the argument, is it bibliometrics, is it autometrics, and so on. So these arguments, might have some level of validity, but the truth is that is a concern and is a challenge that is being posed for several persons who, put some kind of value, rightly so, in some of the publishing platforms. Now we have issues around regulatory and ethical concerns, associations, institutions, countries even, having some form of regulatory terms. We are still having a very, low adoption of regulation, at the national level, at the organizational level, stakeholder level, with respect to sharing preprint. And I think this is one of the concerns. And again, ethical issues. There are critical health issues that one will want to say, if I share them as preprints, what is the direct impact is going to make in the translation in the community, in the translation in the open society. So these are some of the concerns that, some scholars, have that, really limit them. But then, of course, these concerns, next slide, please, these concerns actually, open up opportunities, for us to advance the conversation. So what are the opportunities? We discovered that these preprints actually accelerate knowledge dissemination. They increase visibility, for the individuals who are sharing those preprints, for the organizations that they belong, and also enable quick collaboration. I, for one, have been a beneficiary of having to, collaborate. In fact, my getting launched into the open science space is as a result of, a preprint that I did. And then issue of addressing publication bias. I agree strongly so that, sometimes you have, when your work is coming from a particular place, Global South, for example, some people have some level of aversion for what is coming up. They just feel the work that is coming here does not merit to be on some platforms. So there is some of those biases still exist. And trying to now, give access to, Rwanda and the rest of Africa to a platform like Africa as if, where they can actually, share their preprints, kills those bias almost immediately and gives them the visibility, that they need, for the work that is being done in African setting to come alive. Then you talk about capacity building, it helps, for capacity building, for also cost effectiveness in terms of publication. Of course, we know what funding is in terms of, funding research, especially in Rwanda and the rest of Africa, and then recognition and impact. And then I want to say that public-private partnership is a way to go, such that there will be a sustainable model that will enable preprint to flow. And of course, that preprint in the future will begin to adapt to a public protection proof system, a system that, especially for issues of health concerns, that will somehow have, a way to checkmate, what is being shared to avert any unseen impact in the community at large. Thank you, and I'll hand over to the next speaker to continue. Nuhu, please have the floor.
Thank you, Dr. Akafo. Yes, preprints have come to stay, and actually preprints are really pure open science that scholars, particularly in Africa, need at the right moment. Preprint journals, my first encounter and experience with the preprint journal occurred during my involvement with the Rwandan preprints. I actually participated in an open peer review process alongside fellow researchers on a particular manuscript. And that gave me the first impression of what preprints is all about. Although preprints has been there, but discussing preprints is a bit new to me, despite my experience in the traditional journal and even floating a local journal in my community. So this experience with Rwandan preprints offered me a fresh perspective on the academic approach to manuscript review. Really, preprints are the way forward, particularly to young researchers and the scholars that are beginning to understand the academic publication. I really cherish this factor. Then particularly of interest is that the collaboration of multiple reviewers working simultaneously on a manuscript in a real-time scenario is very, very fascinating. And it was very interesting, my experience with the first outing with the Rwandan Preprint Club. The well-structured review framework equally facilitates a comprehensive evaluation of the manuscript. The precision and the coordination demonstrated by the editorial team is another fantastic thing to write home about and to mention. That collaborative interaction has really empowered me and opened my mind to understanding of real open science. The inspiring exchange of information and ideas among colleagues at instant level is also important. When you engage in preprints discussion or real life review in preprints, you gain a lot. The mutual respects and the orderliness that characterize the entire process is also a lesson for scholars. You learn the academic humility, the academic approach, even the way to communicate with colleagues will be learned during this preprint exercise. The academic strength generated by the collective effort of the team by far surpasses individual contribution as a separate peer reviewer. When a peer reviewer reviews a manuscript in his room or at his personal domain and submit, may not be as bubbling and comprehensive as when you are doing it in open science like we do with preprints. So preprint journals are indeed fast, accurate, transparent, and constructive, significantly increasing the quality of research ideas, particularly with academic community. So I strongly believe that this work by AfriArchives and the Rwandan people should be promoted, and let's have scholars around Africa engage in with preprint activity. Thank you so much.
Okay, I'm going to be sharing. Thank you so much, Nuhu, for sharing your experience. So I'm going to be sharing on behalf of patients their experience, for being part of Rwanda Preprint Club. And I think it resonates with what Nuhu shared, her experience joining, the Preprint Club. First is that, the skills were sharpened when it comes to scientific writing. This is one thing that one will develop, when you begin to share preprint, because you're going to really get feedbacks. And then you're going to have improved critical thinking and analytical skills. This is the typical experience of patients. And again, they helped draft and developed a manuscript, which improved that process and then allowed them to contribute to preprints review sessions. And of course, it also supported their networking and professional growth. So I would say that if you want to be like patients, the first thing is to begin today to start thinking of a preprint. You have that work you want to do, reach out. Africa as if is a way to start, and then drop your preprint, and your experiences definitely will even match patients' own or even much better than that. Thank you very much for your time, everyone.
Thank you very much. That was a very interesting and very enlightening presentation from the Rwanda Preprint Club. And I think we've heard how preprints can actually increase the discoverability of your work. Very enlightening and very interesting for me as a researcher as well. So I think this time we'll take questions. I have a few questions already with me, and I'll also check the chat if we have any questions. For the audience, you can also type in your questions in the chat. So I'm going to check which ones we have, and we can take it from there. Or we could just start it off. I think one specific one that I have here is Dr. Okafor, you mentioned on the awareness, of which I really think it's a very important aspect when raising, when talking about preprints and how they affect discoverability and research. What are the tools or ways that can be used to increase awareness? Because it's a very important one. It's one of the questions that I have here. So if you could touch a bit on that.
Okay, thank you, Colette. So for awareness, for me, based on my experience, I think what works in Africa is actually, direct awareness, mentor-mentee, kind of awareness. It works, better because people will see that you have done this and you're a direct beneficiary of it. And, I have told, some of my mentees, I just, go and put it in this preprint. Don't wait, just go and put it up there, while you are waiting, and that works better. Of course, we talk about advocacies, online advocacies. We talk about using the social media as a platform, but there has to be some level of trust, who am I listening to? Where is it coming from? So if people look up to me, that's sphere of influence. So if we target, early careers, and I think the attention should be focused on early careers in terms of awareness, because when they hold it on, they are going to quickly pass it on into the next generation, and that problem will be solved from the grassroots up. Thank you.
Of course, that is actually true. I want to check if we have any other questions in the chat, and
okay, I think,
sure.
sorry, I think I saw somebody putting up his or her hand previously. We just check.
Okay.
The person still has his hand up, yeah.
On my side, I don't see anything. If you could allow them to speak, that'll be great as well.
All right, if anyone has any question he or she wants to ask you, you can just unmute and ask directly, or type your questions in the Q&A section of this chat. Thank you.
Will it be Jermaine? I'm thinking he's just written.
Yeah, I think Jermaine, what? Probably they're still typing. Or if anyone has a question, they could. Okay, so we have a question on the chat. It's from Jermaine. They say, what can we do to help? For example, I'm in the USA. How can I help? So I think any of the panelists can take that. We're looking at somebody who's willing to assist.
I'm not sure. Help as in.
I'm sorry, Mr. Jermaine.
Okay, so Jermaine says, what can we do to help? And then she continues to say, we as people in the diaspora.
Oh, okay. I think I can take that.
Yes.
If you don't mind. Jermaine, thank you for your question. We in Rwanda Preprint Club, and I also believe other open science and access communities, including AfriArchive, we have been organizing different activities and different webinars to help people open. It is not really restricted. We often don't restrict our activities. We make our activities open for all. And in order to promote that, we are looking forward to making trainings on how to communicate science using the preprint fashion, as well as training people that can actually communicate, review, and help people communicate and develop their preprints. And we are also looking forward to expanding the activities of the Rwanda Preprint Club, such that we do not only focus on Rwandans, but we look at Africans all over the world. Wherever you are free to join. You will be free to join the Rwanda Preprint Club, and that is why we have launched a needs assessment form, so that we can be able to capture what our researchers in emerging from Africa or in Africa settings are looking forward to having. So I think Ebuka is going to be sharing with us a needs assessment form where we can share our ideas, we can capture, and we can make preprints open access, open science more lively and encompassing for everyone wheresoever you are. I hope that answered your question. Thank you.
Right. Okay. Thank you very much, Roseline. There's a question from Colette. Colette wants to. I don't know if you're able to unmute, and then you can ask your question.
I think she's saying we should unmute her.
Oh, okay.
Yeah.
All right. I think we'll do that. Okay. I think Ebuka, maybe you can unmute Colette. While we wait for that, there's a question from Peter. He says, what are the measures that have been taken with regards to data protection laws? That's another question from the Q&A section. What are the measures that have been taken with regards to data protection laws? Maybe one of the panelists can take it while we try to unmute.
Yeah. Sure. Let me try to answer that question. So, Peter, thank you for your question. As almost all the speakers of today have mentioned, we have the persistent identifier that we have the persistent identifier that is being attached or being linked with each preprint that is posted and stamped with a date. So with that, you can be able to justify or protect the data that you have shared and who generated that data. So this is one of the way that you can these are two ways that you can actually protect your data, through the persistent identifier and as well as the dates that are being attached to it. I also believe that the preprint repositories, they have strict policies that bound them. So it is not just made out there for everyone to just access it like that. There is also a process that you have to pass through to get someone's data, maybe for preprint meta-analysis or whatever you would like to do with the data. Things are not just leave laissez-faire. Maybe Mercury can add from the perspective of bioethics as well. Thank you.
Thank you. We are addressing the question of the format of preprint. Is that the question?
Data
Yes,
protection.
Data protection laws.
Data protection laws. Thank you.
Oh, okay. Thank you. We do have different data protection laws across the continent, and also, of course, globally. However, in Africa, we have very few countries which have the data protection acts in place. So most of the time, you find that people rely on the GDPR, the one which is from the UK, and you will find this included in most of the agreements. So generally, when you are let's say submitting a preprint or something like that, you would need to be aware of some of the data protection policies that we have around, so that that once, of course, you have been able to upload your preprint, this is something which is going to be in public use. And of course, people normally fear that once I put out my research, somebody can take it. But you see, that's why preprints are also there. When you do that, you also help yourself to prevent something like that from happening. I am not sure if I have addressed the question or the comments that had been asked. And if I haven't, please let me know.
Okay, I think the chat, there's a bit of activity on the chat as well. And I think we can take one more question. I see one from the chat from Lydia. Lydia says, kindly clarify whether preprints should be the same format as journal articles. What are the components? So I think Lydia is asking on the format of how a preprint is or how it's organized compared to a journal article.
Okay, who is there somebody who wants to pick that, or I can just say from my own experience?
You can go for it. You can go for it.
There are several differences depending on whichever preprint you would have used. However, the main difference is the time it takes to actually get your work out there. And the most of the time when you do publish in the traditional journals, you take very long. You take months or sometimes years. For this other preprint, your work can be out there, within a month. However, it is still going to go through, almost the normal peer review process. The only difference is that sometimes you as the author can choose to adopt the recommendations or choose not to accept some of the recommendations. And all of this will be in public, the public coffers. People can actually see what comments were given and what you actually chose to do. I have actually seen a preprint which had to be withdrawn, or somebody goes ahead and actually changes. So once you change this, even when you go to now publish in the traditional journals, you'll even reduce the time you need to be for the publication, because you have already dealt with some of the issues which would have been raised in your particular manuscript or work.
Okay, thank you very much, Mercury. I'm just going to check if Colette was able to unmute so they can ask that question. Colette, alternatively, you can also type in your question. I'll be able to read it if you're having trouble unmuting yourself. And we have another question. So I think while we wait for Colette, I'm just going to take one last question for the sake of time. It's from the chat as well. It's from Bashir. The question is, as a Crossref sponsor, how can we help you? As a Crossref sponsor, how can we help you? So I think I'll just pass it to the panelists as well. So it's another question of how somebody can be of assistance.
Roseline, you want to take that up? Or you can add your comments. I have something I would want to just add before you come in. This would be to Bashir and also the other person who had said they would want to be able to help from their diaspora. I normally feel that one of the main challenges we have in Africa is the lack of awareness, and if we can be able to find opportunities to have sessions like this, being able to support the opportunities where we could have trainings on how you can be able to do, submit, or what kinds of preprints, how do we, put out a good manuscript, what are we capable of? I normally feel sometimes that's what we need. We need the tools to be able to do some of these things ourselves, and be able to also have that mentality that we can be able to do this. So one of the ways that you can be able to support is through training and mentorship and, attending things like this. Thank you.
Yeah, I do agree with Mercury. This is also coming from first-hand experience with the Rwanda Preprint Club. I happen to work with so many people from different stages of their career and things like that. And we see these challenges. Some of them are still much afraid on maybe their academic supervisors, what they're going to think and say, and higher institutions of learning. Though, for instance, we say that we have preprint repositories, we haven't actually addressed the issue of around preprints and when it comes to scientific communication in the classroom. And so it is in settings or in networks like the Rwanda Preprint Club where we can manage to address issues like this. So we want to plead that if there is a situation where we can have mentorship, discussions like this, and actually training people and using like I will call it human-centered approach to help people actually embrace and appreciate preprints, that will much be better. And I think Bashir would like to help add more flesh to what we have said. Thank you.
Bashir, you can go ahead. I'll give you just a few minutes because we're running out of time.
Thank you. Thank you very much. Can you hear me?
Yes, we can hear you.
Okay. As we are cross-rep sponsor in Middle East and Africa, we have many ideas to help publisher and the scientific institution in Africa. As you know, many countries in Africa are free registration in the DOI. They don't need to pay any fees. We can set up a digital platform or websites in OGS or in OMP for any publisher need this. Just contact me and try to collaborate positively with us. We can do something better for Africa and for preprint or for journal and scientific publication. Thank you very much.
Thank you very much, Bashir. That's well noted. Thank you very much. All right.
I think Colette can speak now.
Okay, great. Colette, I'm just going to give you a few minutes because we're running out of time, and you can speak. I just saw that you're able to unmute yourself.
I don't understand if you have sent a question for me.
No. It's for Colette. No, it's fine. Thank you, Bashir. Everything you said is well noted. Thank you.
Thank you. You are welcome. Thank you.
Thank you. Colette, go ahead, please.
If she's still having difficulties, maybe you can just move ahead.
Okay.
Yeah.
And Colette? Okay, I think she's still having a bit of a problem. Okay, so I think we can wrap up. Thank you very much for joining us, everyone, on our webinar today. The recording session will be available, and you can find it on our website at africaarchive.org, and the materials for this particular webinar session as well. And that's where you can also find information about our next webinar series again that will be happening. And just to reiterate, this webinar series is co-organized by Ubuntu Net Alliance and Access to Perspectives as part of the ORCID Global Participation Program. Thank you very much for joining us, and we look forward to having you again on our next webinars. Thank you.
Bye. Thank you. Bye.
Yeah. Thank you. Bye-bye.
Bye.
Thank you. Bye.
Thank you, Roseline.
Thank you. No.